My name is Janet and this is Josh, and we are student physical therapist assistants, and today we are co-treating JD, a 22-year-old student who was involved in an MVA 22 days ago. He was admitted to the trauma center with a fracture and a complete SCI at the T10 level. He also sustained fractures to the 9th, 10th, and 11th ribs on the right side. He underwent spinal stabilization surgery. During his stay at the trauma center, JD developed pneumonia with decreased secretions. While at the trauma center, JD received acute therapies for range of motion, positioning in bed, transitioning to sitting, patient-family education, and active breathing exercises. He also uses a TLSO at all times when out of bed, no brace in bed per doctor's orders. He was 3 weeks after his injury, he was moved to an inpatient rehab facility. So today, we are going to be working with JD to improve his bilateral upper extremity strength in all muscle groups to a 5 out of 5. Currently, JD is a 4 out of 5 bilateral upper extremity strength throughout. Due to his injury, JD is going to rely heavily on his upper extremities for his movement. We will also work on transfers from wheelchair to mat with a sliding board to work towards wheelchair independence. Currently, JD is a max assist ×1 with a sliding board to transfer between level surfaces. So I'm going to gel in, and then we're going to begin our treatment. Hello there, JD.
Hello, hello.
My name is Janet. I'm a student physical therapist assistant. Before we begin today, can I just confirm your name and date of birth, please?
Yes, my name is JD. My date of birth is June 1st, 1997.
Perfect, and that's what I have here. So JD, we're going to do a couple of things this morning, and then Josh is going to come in and treat. So the first things we're going to do is I'm going to do is just some measurements on you just to see where we are, make sure that we're maintaining or improving, and then we're going to work on some activities. Is that okay with you?
Sounds like a plan.
Perfect. Okay, so I understand that we had some rib fractures and they're healing, so it's not a great idea to have you lie down currently. So what I'd like to do is look at your triceps, and in order to do that, I'm just going to have you seated here, and I'll sit to support you on the side.
All right.
What we're going to do is I'm just going to have you bring your arm up overhead, extend back, and flex back, and then extend up.
Okay.
It's easy enough?
Yeah.
After you move through that motion, then I'm going to give you some resistance, okay?
Sounds like
Perfect. All right, so I'm going to sit here beside you.
All right.
Just help support your body.
All right.
All right, so first I'd like you to take this arm up overhead. Great, and can you flex back behind your head?
Yep.
And can you bring it back up? Great. So this time I'm going to have you go back, bring it halfway, and hold. Don't let me push it down. Hold, hold, hold. Perfect. Okay, and rest that hand back down.
Thanks.
Great, and I'm going to come around to the other side.
All right.
We're going to do the same thing.
Okay.
So you're going to bring this arm up overhead.
All right.
Great. And then go ahead back behind your head and back up. Great. Now I want you to go halfway and hold. Hold,
Okay.
hold, hold, hold. Excellent. How did that feel?
Not too bad.
Okay, good. So you're about a 4+ out of 5, so we're definitely making some improvements with our upper body strengthening.
Sounds
So that's
awesome.
fantastic. Very, very good. Okay, so the next thing we're going to do is I want to look at your range of motion in your ankle.
All right.
Okay? So for you, as you progress, you get stronger, your upper body gets stronger. You're going to be using your feet as a pivot point for your movements.
All right.
So it's important that we don't develop any contractures in the feet, and that we can keep our dorsiflexion in neutral.
All right.
Okay? So what I'm going to do is I'm going to use this and put this underneath your knee.
Okay.
Okay.
Sorry, very heavy.
Oh, it's totally fine. And I'm going to get down here so I can see what I'm doing.
Sounds like a plan.
And you just relax for me. Perfect. Excellent. And we're going to go around to the other side. So you're right at neutral, which is where we want you to be. Okay. So let's
Excellent.
check this side.
All right.
So we'll move our bolster here. Okay. And we'll do the same thing on this side, okay?
Excellent.
Perfect. Feeling okay?
Feel pretty good.
Good.
It's a good day today.
Good day today?
Yeah,
Excellent,
it's a good
excellent.
Monday.
Perfect. Okay, so we're all finished with that part. So we have a couple more things to do. We need to do heart rate on you, okay? So we're gonna check that, so you don't have to do a thing. I'm gonna sit beside you to help support you because I know that you need your upper bodies to support while sitting.
Yeah.
So I'll support you and you're just gonna hang out for a minute while I do a little check.
Sounds like a plan.
All right, so just rest your arm here. Perfect. Okay, great. You can put that arm back down. Got it?
Mm-hmm.
Okay, great. So your heart rate was 83. Respirations, I also did that while you were
Oh.
we were checking that, and they were at 13. Both are within normal limits, so
Oh,
that's
it's better
going
than
really
last
well.
time.
It is. So how are those breathing exercises going? They're doing okay?
Doing all right. I need to do it more.
Okay,
Yeah,
yeah, it's
the
important,
luggage.
especially with that pneumonia.
Yeah, it's getting to me.
Yeah, definitely. Okay, so are you ready to move on to a couple exercises?
Sure, why not?
Okay, so what we're going to do now is we're going to work on some sitting balance.
Okay.
And we're going to do just a couple little things here, and then we'll go into something else.
Sounds like
All right, so what I'm going to do is we're going to work on some weight shifting.
Okay.
All right, so I am going to give you some nudges, and we're just going to keep your hands there, but we're just going to move a little bit. So I want you to come forward.
Okay.
Much better. Okay, so we're going to move side
Okay.
to side. And we're going to do this for a minute. All right. And then we're going to come forward and back. Feeling okay?
Mm-hmm. Great. Trying to
Keep doing that.
feel it out.
Yeah, keep doing that breathing. Excellent. And we'll go side to side again. Excellent. Okay, now it's going to be tricky.
Tricky?
Ready? A little bit tricky. What I want you to do is take your right arm and touch my shoulder. Put it back to the bed. Good. We're going to do it 10 times. Ready?
Each arm?
Yes, but stay on the right side first.
Okay.
Okay? Good. Good. And one more. Excellent. Now let's do the left side. Take a break. You're doing great.
This thing's tight on me.
I know. I'm so proud of you for wearing your TLSO.
Thank you.
It's
Thank
awesome.
you. All right, left side.
Left side. You ready? You got it. Good. Okay, one more. Excellent. Excellent. You okay?
Yeah.
All right,
feeling
get a
good.
breather there. You're doing great. Okay, so we're going to work on this 5 times a week.
Okay.
You know, it's important for you to work on, you know, that independence in sitting, finding that balance. So we'll get there.
Sounds like
You're doing a
plan.
great job. So what I'm going to do now is I'm going to go grab Josh, and he's going to come in and he's going to finish up the day with you.
Josh, okay.
Yeah. You
Deal.
ready?
Sure.
Okay.
30 is a tough one.
Perfect.
Hey JD, how you doing today?
Hey.
Good. My name is Josh. I'm gonna be your next week physical therapy assistant today.
Perfect.
Just to make sure everything's looking good on the board here. Can I get your date of birth?
Sure. JD 6197.
Good. Sounds like a plan. Looks like I got everything right there. So, Jan was informing me everything went well this morning. Feeling
Yeah.
pretty good.
Feeling good.
Ready to move on to the next exercises?
Ready.
Awesome. So the next thing we're gonna do is we're gonna work on some scapular strengthening. Okay.
Okay.
So I got a green band set up over here.
Okay.
So we're doing some kind of lat pull down. So before we go, actually, if you can pull up right over here for me.
Sure.
Good. Getting along well with the wheelchair.
Getting stronger.
Good. So I'm actually going to demo it for you first.
Okay.
Then we can actually go through it together. How's that
Sure.
sound? Awesome.
Fantastic.
Awesome. So, essentially all we're going to do over here is set up in a good position. That way we can reach and get that the green band, okay?
Okay.
So then make sure we get locked that wheelchair as well.
Okay.
I'll make sure it gets nice and locked. From there, what we're going to do is grab this green wonderful band here.
Okay.
Make sure elbows are locked.
Okay.
And then we're just going to pull down
All right.
and focus on squeezing the scapula. So what's cool with this is you can actually do this in the wheelchair.
Oh, good.
Yep. Without too much of a hindrance. And then what we'll do today as well is we'll do 2 sets of 15 reps.
Okay.
And then we'll talk about how you felt.
Okay.
Does that sound like a plan?
Yeah.
All right. So go ahead and let's get on over here. Just make
Right
sure.
up here.
Yep.
Okay.
Good. Lock
I'm
that.
gonna lock this side.
Lock it. Good.
Got it.
All right. Let's go ahead and make sure elbows are straight, locked out.
Okay.
And the goal here too is make sure we actually squeeze the shoulder blades back before we pull down. So go ahead and squeeze that. Good.
Okay.
Now pull down. Nice and hold. Good. And up. That's 1. Squeeze and hold. Up. 2. Go to 15.
Okay.
3. Good. That's 14. One more.
Okay.
And relax. That's
Okay.
15. And
Take a break.
Take a little breather.
Okay.
Rest about a minute. How does that feel?
Feels pretty good.
Do you feel it working
I
back
do.
in?
I do.
So what's cool with this is, working these scapular muscles is really going to help us strengthen our ability to, transfer, because you got
Sure.
that scapular stabilization to maneuver, move in your bed, get in and out of the wheelchair, and all that good stuff.
Got it.
So we're going to really strengthen those muscles back there.
Okay.
All right. Let's go ahead and grab again.
Got it.
Go for another set. Good. Good job again. 1. 2. Good. 3. 4. 14. One more. I know you feel the burn.
Feeling it.
And good.
All right.
All right. So what do you think? Feel pretty good?
I like them.
Good weight?
Yeah,
Feel the
I
burn?
think so.
Good. Awesome. So actually feel to roll back up.
Okay, sure.
So
Lock.
put here. Did really well. Good. Some notes for next time. Good. Excellent job. All right, so we got that scapular stretch going. Next is, I know we got to get that those triceps nice and strong. We tested
Sure.
really today. I noticed we are getting them stronger, so let's keep getting them stronger.
Okay.
All right, so moving a wheelchair. A big component is getting up and out of a wheelchair. So those triceps are involved with that. But also, a big thing we got to work on too is pressure relief. All right, so
Yeah.
every 15 minutes. I know we talked to you earlier about that, but yeah, every 15 minutes we're going to do some pressure relief.
Okay.
So the chair press is a great technique to actually pressure relieve yourself.
Yeah.
That way there's no pressure ulcers or anything like that going on
Sure.
down the road. So a great way to do it is just make sure stay upright and good hand placement here.
Mhm.
Just press it up
Okay.
and controlling down.
Sure.
So last thing I want you to do is press up, flaps down.
Yeah.
So make sure we go up, get a nice little tempo down there. And more time on attention and more strength we build there as well.
Sure.
All right, so today what we'll do, we'll start off with, we'll try 15 reps.
Okay.
And then we'll see what we do after that first set.
Okay.
And then we'll go to the next part. So
All right.
Do that. Yep, whatever. All that stuff. Good.
All
So
right.
it's going to get in a good position.
Got my chair locked.
Yeah, wheelchair is locked.
Yes, sir.
All right, feel pretty good.
Yes, sir.
All right, let's go ahead and press on up.
Okay.
Good. 1, 2, come all the way down. There we go. 3, 4, skip. 14, control the way down, and relax. Good. Very good. Now
Okay.
breathe.
All right.
How'd that feel?
Pretty good.
Awesome. We'll rest a little bit. Make sure we get some built-in recovery there. That way we can do another good set here.
Okay.
It's better than last time.
I think it's getting a lot better.
I think the
We're
progression
getting a lot
rate,
stronger.
yeah.
I'm ready to go.
I know. Such a young buck, right?
That's me.
All right, let's go ahead. Let's get this up. Another set here.
Okay, ready?
Ready, and press. Good, and down. Good. Excellent job. Fully lock up those arms. Good. This will be number 14 here. I got one more.
Okay.
And we rest.
Woo. Woo.
All right, take a breather.
Working me
Yeah,
today.
you're feeling good, aren't
You
you?
guys are getting me.
All right. Make sure it's down.
Okay.
Over your pressure relief techniques. That's
Mhm.
great. Good job with keeping that control on the way down. Don't get collapse there. And yeah, so that's really going, over time this will help you get better with your transfers and
Sure.
bed mobility stuff.
Okay.
Speaking of bed mobility and transfers, we're going to work on transfers next out of the wheelchair to a mat.
Okay, so move out of this area.
Yeah, I got you. Yeah. I'll make sure you're
Okay.
okay.
I'm unlocked. I'm ready for you.
You're unlocked, ready to roll?
Yes.
Okay, so the goal, what we're going to do today is just, to practice it on building that independency on getting from the wheelchair to the mat.
Okay.
And a good technique and important thing to know is positioning when it comes to your wheelchair and to the mat.
Okay.
Obviously, we'll get close as possible, the best angle as possible, because we'll make it the most efficient transfer as possible.
Sure.
Okay. So what we're going to do first is I want you to go ahead and lock
here.
Lock them up. That's right.
Okay.
All right. So today we'll use a sliding board,
Okay.
and this is going to be a great way for us to eventually be able to do this independently.
Okay.
So a good reminder on the sliding board is just to make sure when pressing across, do not clamp your hands in here or over here.
Okay.
Last thing we'll do is smush your fingers.
Yeah.
Or hurt anything else. All right. So
Right.
make sure my hands all the way across.
Okay.
All right, so what we'll do here is just make sure we get from here, nice and safe.
Okay.
Is that like plan?
Yes.
All right, so the first thing I want you to do is make sure we release that.
Like this? Okay.
Yep.
Got it.
And what we're going to do is if we can slide forward a little bit.
Okay.
Yep. Good. We'll use this triceps and slide forward push. Good. Now we're going to lean over.
Okay.
You can lean over to the side here. Good. And we'll slide it underneath you.
Okay.
All right, I'm going to bring this down a tad. All right, looks like we're in a good position. How do you feel?
Pretty good.
All right, so what I'm going to allow you to do is you do as much as you can as possible, and I'm going to be there to assist you along the way.
Okay.
All right, so the goal is when I say 3, 2, 1, go, we're going to move. All
Okay.
right, go to where you can go.
All right.
There, we reset our hands, all that good stuff. 3, 2, 1, go. It's over.
Yes, sir.
Good to go here. All right, does that sound good?
Fantastic.
All right, so your head to be over here on the side here.
Okay.
All right, and we'll block your legs.
Okay.
Count 3. You're going to push off with your arms.
Okay.
And we'll slide. All right.
Okay.
1, 2, 3, go. Good. Excellent job. Excellent job. All right, lean forward. 3, 2, 1, slide. Good. We get one more.
Okay.
All right, 3, 2, 1. Good job.
Okay.
How you feeling?
Pretty good.
All right. Move this up the way for you.
Got it.
Put you here.
Okay.
All right. Move this up the way.
Okay.
And what we'll do is just get you safely across here.
Okay.
So on the count of 3, we're going to lean back and lie down. Right?
Okay.
1, 2, 3. Good. Arms. Good. We'll get the skate off you.
Okay.
How are we feeling?
Getting a little tired.
Feeling a little tired?
Yeah.
All right. So next on the agenda is come to the end of our session now.
Yeah.
All right, so time to rest. But before we do that, before our next session, I have a few exercises I would love for you to do.
Sure.
Okay?
Okay.
So the first one we're going to do is we're going to do something called bed rolling.
Okay.
Yeah. So the goal is to try to get independently up to sitting.
Sure.
Do your bed as much as possible. So a great way to do that is bed rolling. So essentially, what we'll do, so don't do it yet, we'll tuck our chin, bring our hands up to about 90 degrees, so right in front of you, and then we're going to use that momentum
Right.
to kind of roll us to our side.
Okay.
So all we're going to do today, or on your own, is one time per
Okay.
day for like 30 seconds.
Sure.
We're talking about rolling.
Got it.
So go ahead and bring your arms up, tuck that chin, and go take and roll. Good.
Got it.
Yep, just like that.
Okay.
Yep.
Can do.
Yep, so you'll be able to do that on your own. And then from there, we actually work some dead bugs as well.
Sure.
So what a dead bug is essentially, we're going to make sure we're staying nice and tight, so we still tuck our chin, arms up again in that one position, and then we're going to go all the way back, back down, all the way back, back down, without arching back, okay? So
Sure.
it's nice and tight. So we'll do 3 sets of 10 per arm.
Sure.
So what we're doing there, obviously, is build some stabilization through there, but also build some muscular endurance. Since you're already using your arms a lot, you need to build some endurance in those muscles too. That way, you sustain long durations of movement around.
Okay.
So can we see that?
Sure.
Tuck the
Tuck.
chin,
Arms
arm up.
here.
Yep. Good. Very good. So no.
Okay.
Good. And excellent. And
Okay.
relax. How'd that feel?
Pretty good.
All right. So I'm gonna go put a little thing here for you.
Okay.
Block. I'll be right back. Okay.
All right.
So, the next thing we have, down is getting pull aparts.
Right.
So kind of come off of our lat, pull down and work on those scapular muscles.
Mhm.
This works the exact same thing.
Okay.
And we do this while we're lying down, which is really nice.
Sure.
So all you're gonna do, the same exact plane with your arms, you'll come up 90 degrees.
Mhm.
Before we go, you wanna make sure we're pinning squeeze our shoulder blade muscles into the ground,
Okay.
into your mat, and we're gonna pull apart,
Okay.
roll it up. All right,
Got it.
so let's try that.
Okay. Okay.
Pull apart, good. Make sure the fire is, yeah, good. I say we do about, same thing, 2 sets of 15 right there.
2:15.
How's that feel?
Pretty good.
Think you can do that?
Yeah, I think so.
Awesome. So what I'm gonna do here is, before I head on out, I'm gonna give you the home exercise program.
Oh, perfect.
That way you know
It's
exactly
gonna
what
be
to do.
hard for me to remember all of that.
It's a lot of work.
Yeah.
You know, you earned yourself a nice little nap today, but JD, you did a phenomenal job. Proud of your gains. I can't wait to see you again next time.
Awesome.
Have a great
Appreciate
day.
it. Thank you so much.
Absolutely. Good job.